Hello, my name is Janet Benedict, and I am a student at Colorado Mesa University. In this presentation, I will discuss workforce issues as they relate to nursing and the balancing act that nursing leaders must play between fiscal and professional responsibility. The purpose of this presentation is to help you develop a better understanding of workforce issues as they relate to the nursing profession. I will also be discussing some current trends and issues that nurses are experiencing and how these elements potentially or actually impact nursing. As I reviewed the literature, I identified several themes, which include nurses and the importance of policymaking, ways in which nurse leaders go about selecting nurses for their units, how they retain those nurses, the ways in which nurse leaders can influence the culture of their unit, and finally, I will examine the impact that a good or bad leader can have on nursing. Every nurse feels the effects of negative workforce issues, which is why we all need to be proactive in supporting legislation that could have a significant impact on improving our practice and supporting nursing and attaining good patient outcomes. I have listed 3 of the most current and noteworthy bills that we should be encouraging our legislators to support. Many policy-making sessions aimed at making decisions about nurses at the government level and the organizational level are being held without nurses' input. We need to be at the table to make our collective voices heard. One of the most significant tasks that nurse leaders are responsible for is selecting nurses that will make up the workforce on their units. It is imperative for them to make the best choices. I found that most leaders use multiple assessment methods in the selection of their process. Many of the tools available are not considered to have a high rate of reliability. Unfortunately, due to the current nursing shortage, they must permit the supply of available nurses to dictate their choices. But if they do have a choice, they will be looking for specific attributes. The top 3 are clinical skills, communication ability, and signs that the applicant has good clinical judgment. They are also looking for attitudes and behaviors that could indicate that the nurse would be compatible for their unit. Once a workforce is attained, and I say that as if there wasn't already one in place, it must be maintained. Nurse leaders need to ensure that their nurses are educated and highly functioning. It is imperative to monitor for staffing issues, frequently review workloads or any other concerns. It is important to monitor for burnout and implement strategies to prevent it. Appraisals should be used to identify gaps in the knowledge and to plan strategies for improvement. One of the problems that nurse leaders face is the lack of reliable workload and acuity data in order to advocate for their nurses. Most organizations attempt to define the responsibilities of nursing, which does not comprehensively account for the psychological elements of care that defines nursing professionals. Organizations would like to maintain control over nurse scheduling, or as they say, flexibility. They say they want their flexibility to ensure that staffing is appropriate, but this most commonly means cutting staff and pay. This situation is one in which legislation could help protect the nurses by keeping organizations accountable. The literature suggests that effective preceptorship and mentorship programs can ensure that new nurses are prepared to practice safely and studies show that these programs increase nurse retention rates. We all know that there is a nursing shortage and that nurses are getting older, all of which has an adverse impact on the nursing workforce. This literature review indicates that leadership can have a profound impact on nurses in both positive and negative ways. It shows that the most successful nurse leaders give lots of praise, inspire their nurses to work as a team, and to accomplish great things together. They provide for continued education, empower their nurses, lead by example, identify acceptable risks in order to make positive changes, negotiate conflicts, and implement strategies to prevent burnout. As I said before, leaders must find a balance between their professional responsibility to ensure adequate staffing and their responsibility to the organization to balance their budgets. Great leaders advocate for their staff. Research shows that good leadership is associated with a positive unit culture, and a good leadership is associated with less absenteeism from sickness. Nurse leaders must respect and support their staff in order to foster a positive culture in the workplace. There are multiple studies that show the positive effects that a good nurse leader can have. A nurse leader must empower their nurses to create their own positive culture, maintain adequate staffing, use appraisals to develop their staff, and studies indicate that units which engage in respect and conflict training have a more positive workplace culture. The unit must be staffed based on patient acuity and not the supply of nurses. A leader needs to ensure that the staff is distributed in a productive way. The Dartmouth-Hitchcock uses a professional practice model which integrates 4 realms of practice. The practitioner is accountable to the public's trust. The leader, decision maker, collaborates with other professionals and the patient to guide care. The scientist uses evidence-based strategies to give their practice more meaning. And the transferor teaches, transferring evidence-based knowledge to the patient and family to empower them to improve upon their own health. Dartmouth-Hitchcock believes that this nursing model transcends functional nursing models as it brings meaning and significance to our professional practice. I've included the website in the list of references. Studies show that the following are actual impacts that workforce issues can have on nursing quality and safety, and not just for the patient. Most of these impacts are due to inadequate staffing and are well documented in the literature. Staff nurses and leaders both frequently feel frustrated. Inadequate staffing increases mortality rates. Organizations who want their flexibility tend to cut corners by decreasing pay and cutting staff. Nurses are too busy to be innovative. They are frequently anxious and depressed. Nurses are having trouble getting everything done because they are having to multitask continuously. Studies show a definite link between the nurse's well-being and the patient's well-being. Nurses are having trouble balancing their life and work responsibilities. They are fatigued, which increases the risk of back injuries and mistakes. Many nurses are suffering from emotional distress due to the ethical dilemma they encounter when they are unable to provide adequate care. They are overworked and frequently sick. Some of them are getting old and will retire soon, which will further decrease the supply of nurses. In one of the studies, a head nurse is quoted as saying that her nurses are so busy that they are having to prioritize their care, and she relates the way that One of her nurses had left a nasogastric tube in place because she doesn't have time to feed the patient without it. This is simply wrong, but this situation and others like it are occurring frequently. I have already talked about fatigue and putting nurses at greater risk for injury. Nurses are frequently suffering from chronic health conditions related to stress from being overworked. Fatigue can have a profound effect outside of work also. There are many healthcare professionals putting themselves and the public at risk by driving drowsy. Studies show that the emotional distress felt by nurses due to the ethical dilemma of not having enough time to care for their patients has an adverse impact on patient care. Being understaffed creates friction in clinical units. Quality and safety are being sacrificed and performance is decreased. Overtime is being used to compensate for understaffing and other staffing variables. Studies have shown that inadequate staffing increases nosocomial infections. My conclusion for this literature review is that inadequate staffing of nurses is decreasing the quality and safety of patient care, is making nurses very sick and at greater risk for various injuries. Nurse leaders are essential for the advocacy of adequate staffing and for leading the way and helping their nurses to lobby for policies that will protect them from understaffing. Nurses are in short supply and are becoming burned out. The bottom line is that adequate staffing is critical for good patient outcomes and happy, healthy nurses. Nurses need to stick together and make their voices heard and fight for the right to do what defines them, which is care for their patients. I sincerely hope that I have succeeded in achieving the purpose of this presentation, and I hope that you enjoyed it. Thank you for watching.